Hi viewers and welcome to my channel. So today we are going to talk about Kenyan hospital. In Kenya, getting sick can turn a family's whole life upside down. You take your loved one to hospital hoping they'll get treatment, but before the doctor even finishes explaining the diagnosis, your mind has already started calculating, how much do I have in my account? How much is in my M-Pesa? Who can I borrow the money? What can I sell? Because one hospital visit can wipe out your savings, push you into debt, or even force you to sell property, or even close a business. So you went looking for medicine, but suddenly the bill needs its own emergency department. And that is the painful reality for many Kenyan families. So when sickness comes, we worry about saving a life and whether we can afford to survive the bill. Hospitals and healthcare providers need proper regulation and accountability. Now, before someone says this person is attacking hospitals, no, this is not the point. Doctors, nurses, clinical officers, and other healthcare workers do an incredible, important jobs. They save lives, and we appreciate them. But we also have to be honest about what ordinary Kenyans are going through. Medical costs are becoming unbearable. Families are getting into debt. Businesses are collapsing. Some people are selling property just to keep a loved one in treatment. And when the patient finally gets better, the family is left staring at the bill. Like, sometimes you feel like saying, so the disease is gone, but now the hospital bill has become the new patient. Because the bill also needs some treatment. So the most painful part is that when someone is sick, they are vulnerable. You do not walk into hospital thinking, let me negotiate this bill like I'm buying a sofa. No, you don't do that. Your mother is sick, your father is sick, your child is sick, your spouse is sick, or even yourself, you're sick. You know what? You're scared, you're desperate, you just need help. And to be sincere, in that moment, many people do not even know what questions to ask. What exactly are we being charged for? Is this procedure necessary? Is there a cheap alternative? Can this treatment be done as an outpatient? Are all these tests really necessary? I'm not saying every treatment or procedure is unnecessary. Don't get me wrong. I know medical decisions should be made by qualified professionals. But patients and families deserve transparency. They deserve clear explanation. They deserve reasonable charges. And they deserve protection from exploitation. Because some of it, to be sincere, is exploitation. So another concern I've seen, and I'm sure many Kenyans have experienced it, is someone being admitted for a condition that could possibly be treated without admission. Let me be clear, the patient's condition must always come first, and medical decisions should be made by qualified professionals. But we also need systems that prevent unnecessary admissions, tests, and procedures from becoming a financial burden on families. Because sometimes you go to hospital with a small problem and suddenly you hear, madam, we need to admit your child. And you're there thinking, admit my child for what? I came here with a headache, or my child came here with a headache. Why do you need to admit my child? Then they give you a bed. Then they give you a file. Then they give you a bill. And now you're lying there thinking, at this point, even the headache is cheaper than the bill. But behind the humor is a serious issue. Healthcare should be about healing people, not financially breaking them. Mr. President, do something. So, Mr. President, I'm appealing to you. I'm also appealing to the Ministry of Health and everyone responsible for regulating healthcare in Kenya. Please do something. Not just speeches, not just promises. We need practical action. We need stronger oversight of hospital charges. We need transparent bills. Patients should understand exactly what they are paying for. We also need proper system for people to challenge unreasonable charges, and stronger protection for vulnerable patients and families. Where healthcare providers are found to be exploiting people, there must be accountability, because wananchi are struggling. People are drowning in debt. Some are selling homes, others are selling businesses. Families are losing everything where they're trying to save one person. That cannot be the normal price of getting sick. And this is where I say, please don't exploit vulnerable people. And remember, wananchi are watching, wananchi are feeling the pressure. The cost of living is already high. Food is expensive, rent is expensive, transport is expensive, school fees is expensive. Then sickness arrives and says, surprise, here is another bill. So at some point, something has to change. We cannot build a healthy nation when people are afraid to go to hospital because they are terrified of what will happen to their finances. So, Minister of Health and everyone responsible for healthcare in Kenya, do something. Do something reasonable. Do something practical. Regulate where regulation is needed. Protect patients. Protect families, make healthcare transparent, make people feel safe when they walk in hospitals, not like they have just entered a financial casino. We all deserve good healthcare. We all deserve dignity. Nobody should have to choose between saving a loved one and saving their entire family's future. Kenyans are struggling, for real. Kenyans are struggling. Mwananchi anateseka. Please listen to mwananchi. Do something. And if you agree, share this video. Let this conversation reach the people who have the power to make a difference. Because when it comes to healthcare, we are not asking about luxury. We are asking for fairness. Thank you so much for listening.